Hello and welcome to this episode of our video podcast series, Healing Healthcare, How Industry Changemakers Are Improving Healthcare. I'm Chris Yeager, Vice President with Reed Associates, and I'll be your host today. Joining us is Kathy Chang, Head of Trade Relations at Blue Shield of California. Kathy, thanks for speaking with us today. I'm looking forward to our conversation. Today's episode is particularly exciting to us because we're following up on a prior episode of Blue Shield's pharmacy transformation efforts to hear about your progress over the past 3 years. Before we dive in, Kathy, would you mind introducing yourself and telling us a little bit about the work you've been leading at Blue Shield?
Yeah, thanks, Chris. It's great to be here and talk about how we can heal healthcare together. My name is Kathy Chang. I'm a pharmacist by background. I've been in the pharmacy benefit management or PBM space for more than 20 years. In the early days, I started out at Prescription Solutions, which later became OptumRx, where I served in various leadership capacity within industry relations. I'm currently head of trade relations at Blue Shield of California. I lead efforts to transform how we contract for drugs differently to ensure that we deliver on the value, the affordability, and most importantly, price transparency for our members. I'm just excited to be part of this transformation that Blue Shield is creating in the pharmacy industry.
Great, thank you. Well, 2 years ago, Blue Shield announced its Pharmacy Care Reimagined program with a goal of providing every person with safe, equitable access to sustainably affordable prescription drugs. One of the core strategies of this program, as you mentioned, is improving price transparency. What are some of the transparency efforts you've been pursuing, and what results have you been seeing?
Thanks, Chris. I think that's a really great question. I think transparency is such an important topic to address because of the financial pressures that we continue to see patients face when they're at the pharmacy counter. Our Pharmacy Care Reimagined program was really born from the idea that everyone should have safe, equitable, and sustainably affordable access to the medications. And a key component of that is to really ensure that there's transparency to the price so that members can then make informed financial decisions with their providers. And I think our current pharmacy model today makes it very difficult to know the real price of medication due to all the questionable practices that we know exist in the system, such as spread pricing, pharmacy markups, manufacturer rebate that reduces the cost of a medication, but something that the patients never see.
Mhm.
And if you think about it, PBM was supposed to help drive costs down, but they're now part of a larger mega size organization that has ownerships in areas of pharmacy chain that prioritizes profits over savings. So it's made it even harder to see the true price of the drug. And so for Blue Shield, for us to be able to get to transparency, we felt that we needed to really unbundle the current pharmacy distribution system and strip away from all of those misaligned incentives. And so instead of having a single PBM that supports all the services that we know today, such as contracting, mail deliveries, retail pharmacies, all of that, we're really working in a modular approach where each of the vendors has its own role in the pharmacy chain, but yet they're not tied to each other. There's no affiliation. So it minimizes that conflict of interest. And so as an example, Amazon, who we use to support our home delivery, they are there to support delivery of the medications to our members while providing the pricing up front. There isn't another entity as part of that equation that is either affiliated or owned by Amazon that has its own incentive in driving the volume towards Amazon. We purposely designed it so that this modular solution allows us to keep everybody sort of honest in how they deliver the service. But at the same time, it also allows us to have that direct visibility into the cost of the medications and every step of the pharmacy chain. And once we do that, then we can feed that same transparent pricing information to the members now, which after, once you can do that, then you can integrate digital solutions like the Price Check My RX tool that our members have access to, where they can then see the actual pricing of their medications in real time. So, that's not something that, if you think about it, it's not something that a patient had access to before. They were told that these are the drugs, but they've never seen the price. And so now we have the capability to do that in this tool that Blue Shield has. And so it's really about putting the engagement back with the members, back with the providers, so that their healthcare cost becomes transparent, and then they can make those right decisions that is right for them, along with their providers.
That's great. That's great. In addition to improving price transparency, cost containment, and improving the affordability of prescription drugs, which we all know can be extremely expensive, those are other areas of focus for your pharmacy transformation program. This is probably even trickier to tackle than transparency. What are some of the ways you've been addressing this?
Yeah, affordability is really the heart of what Pharmacy Care Reimagined is all about, providing healthcare that is sustainably affordable for everybody. And so we talked about, why transparency is important, but it's really just one component, because the information is only as good as what's feeding into the system. So if the cost of your drug is high, simply showing that price to the member doesn't really solve the problems for them. And so we wanted to go beyond that in taking real steps and bringing the cost down. And so one of the initiatives that we did about a year ago was on a drug called abiraterone. It's a drug used to treat prostate cancer. The brand cost about $9,000 a month. The generic price was about $3,000 from our specialty pharmacy. And so at that point, we decided that we were going to turn to CivicaScript. So CivicaScript is a nonprofit coalition that Blue Shield have formed with other Blues plan that focuses on providing affordable generic medications to the market. And when we told them about the situation, they were able to secure a price at $171 a month. So this is in comparison to the $3,000 that our specialty pharmacy was offering. It's the same product, it's a generic, same ingredient, same molecule as the brand, but yet we were able to secure a price that was much lower than what our specialty pharmacy was going to charge us. So that's kind of one example. The other biggest move that we also made in providing a lower cost was in direct contracting with manufacturers. When you look at the current pharmacy distribution today, there's a lot of wastage. There are about 5-7 players that really stand in between the drug manufacturer and the patients. Because if you count them right now, there's the PBMs, there's the GPO that contracts for the PBMs, there's the pharmacies, the wholesalers, the GPOs for the pharmacy. I mean, that's a lot of middlemen involved. And the general rule is the more middlemen there are, the more it takes away from the one that directly should benefit from it. So what we decided to do was we didn't want to have to deal with rebates. We didn't want to have to deal with the fees. We felt like all of that was just really unnecessary work. We just wanted to be able to get to the upfront cost of the drug, and that is the price that Blue Shield will pay the manufacturer for that drug. And so that's exactly what we did with the Humira biosimilar deal that we did. So Humira, the brand costed about $6,000-7,000, and biosimilar on the market was anywhere from $1,000 to maybe as high as $4,000 in some cases. We went directly to the manufacturer. In this case, it was Fresenius Kabi. And we told them that we wanted to get to the net price. Ultimately, we don't want to have to deal with all of the rebates behind the scene. And we were ultimately able to secure a price to purchase the drug at $525 per unit, which was a huge, discount from not only where the brand is, but also where the biosimilars were. What we discovered later in an article that Bloomberg published was that that price was actually the lowest price available in the market, even when you compare it to GoodRx or some of these other discount outlets. So for us, it was important to be able to extract the full value that the manufacturer is offering and pass that on directly to our members. We really just didn't want other middlemen to kind of take a portion of that value and put it in their pockets.
Well, that's wonderful for your members. Absolutely wonderful. I believe another focus of your pharmacy transformation work has been to look beyond the price of drugs to the overall clinical value of them. Can you tell us more about that?
Yeah, absolutely. I think balancing patient access with cost containment is really critical in our healthcare today. Our pharmacy transformation initiative is really built on the principle that our affordability should never compromise patient safety or clinical effectiveness. When you think about how we're evaluating medications, we essentially look at the entire picture. We look at the efficacy, we look at the outcomes, we look at how those treatments fit the needs of our members. And so that's why for us in the last couple of years, we expanded our focus to include real world evidence data so that we're focusing on the total cost of healthcare and not just looking at lowering the cost of a drug just by reducing access. And a big part of that effort comes with our partnership with Evio. So Evio is founded by Blue Shield and 4 other Blues plans. And what they've been able to do is to pull all of the data across the plans, and they help us to analyze how medication performs in everyday settings outside of clinical trials. And so the insights that they've been able to bring us have been helpful to identify, for example, if there are drugs that deliver greater benefits to certain populations. It helped us to find areas where maybe we could support providers in making better treatment decisions, where it could be like a message that appears in the electronic medical records that the physicians can see before they see their patients at their appointment. And all of this, the purpose is to simply inform how we think about paying for drugs that work. And ultimately, our goal is to ensure that the right patient receive the right medication at the right time, which then helps to reduce that pharmacy wastage. But I think more importantly, it really helps to personalize that care for our members.
Absolutely. And equitable access to prescription drugs is also a challenge, and Blue Shield has been engaging with communities in new ways to address pharmacy needs in a culturally competent way. But what are some of the things that you've been doing to support your most vulnerable members?
Yeah. So when I think about our vision, we want a plan that is worthy of our friends and our families. And we fundamentally believe that access to affordable and quality healthcare is something that really everyone deserves. And that's why we focus so much on the transparency and we focus on the affordability. One of the things I talked about earlier is the utility of our Price Check My RX tool, which allows members to see that price information in real time. It sounds simple, but it's really not anything that we've had access to previously. And now you have the capability to see real time pricing information based on exactly where your benefit falls. Some of the new feature that was just launched actually about a month ago was that members are immediately notified when their physician puts their medication into e-prescribing. So as soon as that happens, members can even click on that notifications and see the price of their drug. And if for some reason the price is high, they can also maybe see some other low-cost alternatives. So all of this is meant to show and provide the member just that additional information, but ultimately we're trying to do the hard work for them instead of the member trying to work hard to find the low prices for themselves. And so, some of the other things that I think, Blue Shield does really well is having a dedicated pharmacy advocacy team. They work tirelessly to ensure that members are aware of programs or even other offerings that helps to lower their costs. When we made our change to the Humira biosimilar, we made sure that members were informed about the zero cost program that is afforded to them, because we know that healthcare is complicated, and especially when you're sick and you're not feeling well. And we want to make sure that we help our members to understand their benefits, how to help them to navigate their formularies and any of the formulary changes that happen. So, I think when you think about, our ultimate goal here at Blue Shield, it's really to ensure that healthcare costs is transparent so that members can make informed choices, but along the way, removing the unnecessary middlemen in order to keep prices affordable. And we feel that once we can do that, then I think collectively we can help to drive costs down as a whole so that everyone can have quality and affordable healthcare.
Absolutely. Kathy, it's been my very sincere pleasure speaking with you today, and thank you for sharing your insights and experience with us.
Well, thank you, Chris. It's been a real pleasure to be here, and I'm glad I'm able to share the work that Blue Shield is doing to reimagine pharmacy care.
Yeah, we look forward to following the great work that you've been doing and continue to do to transform healthcare. For those of you who've enjoyed this discussion, please check out more episodes of Healing Healthcare, where we uncover how industry changemakers like Kathy have been improving healthcare. You can also follow us free on LinkedIn for industry updates from our team of healthcare professionals. Thank you for joining us and have a healthy day.